a short period of time. I don't want to waste my time. I want to share something which I know in my life. So I got this topic of advanced cardiorespiratory. So at this juncture, the advanced means very advanced, micro advanced or highly advanced, ultra advanced. At this juncture is only COVID regarding pulmonary rehab. I cannot talk beyond that anything because it has been, it is right now in infantile stage in the world. It is around, it's a baby of 6 months to 1 year or 1.5 year baby. 2019 it has started. So I think this is a very, very advanced child and very special child for us. So I think I decided that, okay, I can just give talk on COVID and regarding the perspective of physiotherapist in acute care rehab setting, that is in a respiratory units. So I decided this topic. Okay, now SARS-CoV-2. December 2019 is a date of birth of this virus. It is according to the, what you can call it as astrology, I think. December 2019, the date of birth. And the birthplace is Wuhan, China. And SARS, the name has been given, CoV-2 is, S stands for Severe Acute Respiratory Syndrome of Coronavirus 2. That's why it is called SARS-CoV-2, CoV-2. And family belongs to retrovirus like HIV. His father is HIV, basically belongs to the same genetics of family. Pet name we call it as, with a very love and affection, is COVID-19. And his brother is MERS, that is Middle East Respiratory Syndrome viruses. Okay, now I have a data of August 30, that is 80,000 people. Now I think 1 lakh, above 1 lakh per day. So 80,000 in India according to August, their presence. Okay, I would like to discuss about ACE2. What is ACE2 means? Angiotensin converting enzyme. Before going to talk on angiotensin converting enzyme, I would like to talk about a great thing called, we should understand the virus. Okay, what is the big difference between virus and bacteria? Let us have a very basic difference. See, the bacteria means it can able to reproduce itself. It can reproduce the one more bacteria, whereas the virus cannot intend to produce one more virus. That is the beauty of the virus. So in short, virus is a dead body compared to bacteria. So the dead body cannot be killed again. So that is a challenge all over the world is facing now, because the virus is already a non-living thing, kind of nature, which you cannot kill with anything. So that is a problem we all are facing right now as a challenges. Okay, now let us take about the virus. So if we take a virus, 1 minute. Okay, now if we take a virus, the virus is something like a ball-shaped structure, we all know that, and spikes it have. So the spikes are nothing but protein layers. The spikes are nothing but protein layers. These spikes will go and hang or cling on somebody, and this protein ring, peptide chain of the long peptide chain of the ring is having everything in it. So how come it is? Okay, let us understand first. So if you take a virus, around the virus you have a spikes. The spikes are fat soluble. What is that? Fat soluble peptide. So what is happening means, once a virus enter into the body, you have a fatty layer below the skin. So it is a fat soluble, it can enter into your fat cells easily inside. It can penetrate. So then it can enter into the cell wall, then it can go into the cells. And what is the beauty means, the other bacteria, when they enter into the cell wall, it create hangama. So what will happen, immediately we get some diseased signs and symptoms, so we will start to attack. But here it just, it is inducing into the cell wall chup chop without saying anything, because it is a fat soluble. It does not want to create any hassles. So once it enter into the nucleus of the cell. Nucleus of the cell is something, a brain of the cell. So once it enter into the nucleus of the cell, what is happening means, it is asked the nucleus what it wants to do. So it is something like a real virus of your laptop. or virus of your computer. So how it is, how we can have a synonyms. For example, a computer is having a data operating system, DOS, data operating system. If you have a pen drive or a floppy disk with a virus, once you enter, the virus is something like a program. It enter into the data operating system, it corrupt the computer. So after that, that data operating system cannot control, because data operating system is influenced of this program which we have given is called a virus. So similarly here, this virus is entering into the body. It is entering into the data operating system called nucleus, and there the nucleus, it is instructing the nucleus to produce a similar kind of more virus RNA particles over more and more and more. So it is something like 2.2 version of what you can call it as that robo. So it can just enter, it can penetrate, and without silently, and it can start to react with your nucleus, and it instruct the nucleus to produce more number of virus. So it is reproducing by influencing the nucleus of your own body, of your cell. So that's why this is a very, very pathetic. And moreover, it cannot go and react with all the cells. It is having a high affinity to ACE receptor cell, angiotensin converting enzyme 2, these cells. So the cellular entry, binding of spikes protein and receptor binding domain and ACE2 receptor के साथ मिलता है, मिलके due to affinity. So mostly, if you see, where is your ACE receptors? Unfortunately, the most of the ACE receptors are at respiratory, create a respiratory complication, because the lung is a sensitive organ. Okay, in the lung, which part is more sensitive? Alveolar epithelial type 2 cells of ACE receptors. So alveoli, we call it as actually bullae. Alveoli, it is actually, we call it as air sacs. The air sacs around you have a thin layer, is called basement membrane. In the basement membrane, you have a blood vessel supply where the transfusion occurs. In the blood vessels, the epithelial cells are there. So there the ACE receptors are more. So these ACE receptors just create a, what you can call it as, create a inflammation, because this, once it goes inside, the virus goes inside, it create a fight with the epithelial cell. So epithelial cells start to produce inflammation. So what is inflammation? Inflammation is nothing but healing process of the body. So the body try to heal by itself, so it creates the inflammation. So here the inflammation is a combat to infection. It is an immunity procedure provided by the body to combat to infection. So it produces a lot of pro-inflammatory mediators. That is, we call it as inflammatory cascade. So it gets stimulated COVID-19, and different cytokines and cytokines. That is, the cytokines means a cell kinesis. That is, it is basically a kind of enzymes which is produced, which insult the lung. It's called permanent fatal lung. We call it a cytokine storm. So out of 100 patients, the 5 patients are serious. In the 5 patients, 1.5% of the patients are going for sudden death. The major reason is cytokine storm. So what are the cytokines? Means interleukin 6, interleukin 1 beta, elevation directly linked with the severity of the disease, which we have seen. This is called cytokine storm. So what is the beauty means? The cytokine storm is suddenly it will progress, and it is the inflammatory reaction. The unstopped inflammatory cascade, like a waterfall, reaches destroying all the alveoli and create an insult to the peripheral area of the lungs. So that's why if you see a CT scan of any COVID patient, the opacity, the ground crash opacity is from peripheral to center, not from center to peripheral, because of this ACE2 receptor situation. Okay. In global pandemic, the most patients COVID-19 have mild symptoms, but about 5% severe symptoms they will be include respiratory distress syndrome, septic shock, multiple organ failure. The kidney involvement is frequent with the clinical presentation ranging from mild proteinuria to progressive acute kidney injury. So what is the beauty means? This is in the future, suppose a patient is going to have the acute stage of cytokine storm in the lungs. Second, the ACE receptors are rich in kidney. ACE receptors are rich in arteries, vascular structures. So all these places it goes and just start to create a cytokine storm where the inflammatory cascade started, the pro-inflammatory things have started. So interleukins, all these things gain together, and mostly it is creating a havoc over there. So if we take this picture, this is a very beautiful picture. It shows me to understand that how this is acting in a various way. Why you have a multiple spectrum of patients you are getting. Because of this reason, because endothelium, it is affecting the ACE receptors of endothelium, which is located in all cells, especially in the lung cells, which cause ARDS, stiff lung. You can call it as a, so you need a mechanical ventilation support and everything. And sometimes it affects an endothelium of your blood vessels, which cause stroke and heart attack. And also it creates a hypercoagulability of the epithelium of the connective tissue blood. So that is also reason for myocardial infarction, myocardial dysfunction, all these things. So it is involving in overall area. That's why the very common is in 1.5% of the affected population, the sudden cytokine storm results in multi-organ failure. So this is a beautiful chest CT scan. This is one of the things you can understand easily. If your patients are showing, you see normally these are all actually a central portion, parenchymal tissue of your lung. Whereas mostly in the COVID, specifically you have this opacity on the peripheral region because of ACE receptors are rich in the basement membrane of the alveoli. So that's why you have this peripheral opacity. So if there is a peripheral opacity on the cross section of CT scan of chest, so then you can consider for RT-PCR. Okay, what do you mean by RT-PCR? A reverse transcription polymerase chain reaction. Reverse transcription polymerase chain reaction. So as a therapist, you should know one thing, very important. If somebody is saying, I done my RT-PCR, I am positive case, if somebody is saying, so what you should ask for that laboratory fellow, or you should ask to your doctor is, sir, what is my CT value? What is CT value in RT-PCR means cycle threshold. So what is cycle threshold means? You just have this magic number 24 in your mind. If it is less than 24, then this patient is very vulnerable patient. You should take all damn precaution to treat the patient because there is more chance of viral spread. The load is very high. Suppose if the above 24, that is 28, 30, 40, 50, higher value of CT, then you don't worry, is chance of spread is very less and it is less vulnerable patient in the community as a spreader. So if it is less than 24, they are called super spreaders. Okay. So now let us see the physiotherapy perspective in acute care, where I'm working since last 4 months. So I would like to share my experience. It is not from any book, whatever I learned from my experience and articles which are recently published. So in that case, the 4 areas we should take care: endurance, strength, independence, and safety. These are all the 4 important cluster we should have idea about it on this thing. So let me talk about the physiotherapy perspective of endurance. So where is the endurance is very low means the patient has primary post-acute care. Suppose patient has been admitted and for a COVID and acute care, post-acute care, and ICU acquired weakness is very, very common in the COVID because of oxygen depth and post-intensive care syndrome and dyspnea and oxygen desaturation. These are all the various parameters on endurance. Okay, let me show few examples so you can have a better idea. So in physiotherapy perspective, you find the strength measurement. Definitely in post-COVID patients, strength will be low. And there is a loss of muscle mass is definite, which I have seen since 4 months. Compared to normal ICU patient, these people are fastly losing their muscle mass because one of the reason is they are not getting enough oxygen to the muscular cells. So they are actually, the mitochondria is going for wasting. So because of that, the loss of strength and loss of muscle mass is very faster than the normal ICU neurological patient or ARDS patient compared to COVID patient. So COVID patient, this is very, very important perspective of for physiotherapy. And independence, early discharge to free up the hospital space. So patient are not fully independent at home. Sometimes subacute hard for independent. Yeah, why I use word independence here? Because nowadays, you know, in India, the number of hospital beds was the number of patients available, number of hospital bed and number of patients available, and a number of hospital bed and number of patients available is comparatively, it is lot of difference. So in that sense only, we had government has announced continuously lockdowns, because once a lockdowns happens, so the spreading will be slow. Once the spreading will be slow, we can cater the proper kind of treatment for every patients once they come and they will discharge. So they have reduced the rate of spread to accommodate number of hospitals versus human being ratio. For that reason only actually lockdown happened. Lockdown is nothing relevant to the spread. We have to reduce the rate of spread. Everybody should understand. So for that purpose only so what happens in this situation, mostly the patients, once they become negative, COVID negative, immediately they will discharge, because that bed has to be occupied by one more needy patient immediately. So these patients discharge once they're hemodynamically, they become negative, but not physically. So mostly these patients are more risk of fall in the home. So because they are almost like a patient who are in the weak patient of post ICU syndrome. So they will be discharged early to the home. So the home program physiotherapy for physical recovery is much important. Otherwise their independence will be under the stake. Next is physiotherapy point of view. I would like to talk about safety, weakness, decreased endurance, decreased independence, and put them greater risk of fall. So what you should do means you have to take some fall risk assessment before relieving the patient from the hospital, and also before you are getting involved in the post-COVID rehabilitation at the home, because they discharged early, they are not completely recovered physically. So you should be definitely, therapist should go for there is a chance of greater risk of fall of patient. So better you go for fall risk assessment. It's very critical point. Okay, now let us talk about the oxygen. The most of the patients with COVID-19 will require oxygen supplementation for post-COVID care. So goal to take off them out of oxygen support, because they are in oxygen debt. So our main aim is to remove the oxygen, so the patient should not desaturated even they work. So that is called oxygen depth should be created a low. So oxygen saturation should be monitored very closely on rehabilitation of such a patients. A saturation SpO2 is very important to monitor throughout the session. And strength, the specific viral load. So there are different kind of viral loads are there that difference the strength of the muscles. So prolonged lack of oxygen to the muscle, the longer period of increased rate of respiration, and also increased heart rate with the decreased partial pressure of oxygen, the prolonged bed rest, all this thing results in losing the strength of the muscles. So the muscle, normally what you should do means start with the traditional guideline. You start with muscle power assessment, check for muscle girth wastage and the functional strength assessment and the loss of weight. And you should be very good to differentiate the difference between the weight loss as well as the muscle loss. They both are totally different phenomena. The muscle loss is something you can see much in these patients. The weight loss is including fluid, fat and everything. So you should know very well to differentiate between the weight loss and muscle mass loss should be taken in account as a physiotherapist. And what are the, how you will identify the independence of the patient? You can go with the help of Barthel index, and you can go for transform mobility grading, assistive device grading. Here the assistive device is not a typical physiotherapy aids like what you can walker or walking stick. Apart from that, you should think as a critical care therapist or pulmonary therapist, support here the oxygen. It's very important. So here the assistive device is even oxygen too, and family support and environmental support. So let us take about the safety. So teach the patient of self-monitoring of vital signs like BP, heart rate, Box score, SpO2, fatigue and temperature. They are very important. These are all the things, because you are not going to around the patient throughout the day. So each patient should have a good teaching ability of the therapist to make them comprehensionally understand. The patient should be able to understand and able to monitor by itself. So the teaching is a very important area of the therapist when you go and see with the safety of COVID patients. And other things on endurance, what will you look for patients? You will see for SOB, breathing pattern, and signs of pallor, baseline dyspnea progress with mobility, postural controllable, hold their head and trunk up, and this breathing pattern, whether it is a high breathing pattern or easy effortless breathing pattern, adaptive device or equipment utilization, functional mobility skill, ADL, bed mobility, transfer, ambulation. You have to look all these things for whether the patient is endure or not. So the physiotherapy perspective is three things: mobility, strength, endurance. If mobility is low, strength will low. Strength will low, endurance will low. Endurance will low, again mobility will be low. It is actually a vicious cycle in case of COVID physiotherapy perspective, which I come across with the patients. So this is basically a book score. You just teach the patient to identify the book score. It is similar to VAS score, but regarding the breathlessness severity. Okay, how you will consider oxygen? Did patient use before COVID oxygen? We should understand, suppose patient is having a comorbidity of COPD, restrictive lung disease before COVID. So you should look the patient used COVID oxygen before, or less oxygen or more oxygen comparatively to the now. Use for all the activity or rest continuously. Even rest may they use the oxygen, or on all the activity they used oxygen. During activity only, while sleeping they used oxygen, or prescribed very low oxygen or high oxygen, and delivery method, whether there is a nasal probe or there is a venti mask or there is a rebreathing unit or what it is, and titration of oxygen between saturation, that is consumption of oxygen. All these things should be considered during the oxygen is taken in account in the perspective of physiotherapy. In case of resistance training, use gravity, free weight personals, I always say, because you don't want to sanitize. So use gravity or free weights, and personal it should be. Functional movement training is very good. Small muscle weakness are more than the large muscle group, which I have seen in my practice. Consider the activity induced in hypoxia, quick to fatigue, low weight, more repetition you should feel, and progression based on the patient response is very, very important. You cannot progress as a protocol. Here the progression is because you have a variant of the patients. So progression is based on the patient response, and patient is quick to fatigue, then you give a rest and work in a proper way, and consider the activity induced hypoxia. So you have to just control the oxygen depth. You have to give the training effectively within the fringe width. Let us talk about comorbidities. Suppose patient is having already COPD. Then you should focus on airway clearance because they have a sputum inside. And suppose the patient is having a resistive airway, then oxygen saturation should be considered very beautifully. Suppose patient have a old heart failure, reduced cardiac output, so PP should be monitored every exercise. And patient is having a coronary disease or a stent or something, or PTCA, so maintain the saturation compared to perfusion above 95 during the activity. And pulmonary hypertension, keep SpO2 level very high. So now, what is a breathing training? In the breathing training, the very important muscle is inspiratory muscle training, which is called as your diaphragm. So, and when you start to recruit diaphragm, the accessory muscles of respiration shut down. So basically, when you induce the diaphragm, automatically your parasympathetic activity will enhance. So when the parasympathetic activity enhance, automatically the vascular structures will go for a relaxation. So chest expansion technique, pursed lip breathing is very, very important to improve the PCO2, and diaphragmatic, that is diffused oxygen rate has been increased by pursed lip breathing. And diaphragmatic breathing, again stimulator of parasympathetic activity. Paced breathing for conservation of energy, and you can play fun with the balloon or flute or something like that. So what is the only humble request for a physiotherapist to stop this means a low dose heparin of the body, which can just enhance your immunity. The best way is every half an hour or 1 hour walk for 5 minutes. The sedentary life is sitting is a new smoking, which is very dangerous in case of this infectious era too. So micro walk, my suggestion is micro walk. So with this, I'm just trying to complete my the space which you have given to me. And I think this post-acute care of rehabilitation, the consideration will help you to see the patients. And I hope I did a justice to the topic. And thank you so much. And if you have any doubts, one or two doubts you can ask. Thank you so much.
Thanks a lot, sir, for a great deliberation on a much-needed topic. And during this pandemic, the education of about the COVID-19 and the role of physiotherapy is really much needed. And the cardiorespiratory physiotherapy is well acclaimed, and we have a lot of evidences, and our cardiorespiratory therapists are doing outstanding in this COVID. So, thanking you, sir. We are really much grateful to you that you have spared your precious time and you have agreed to share your knowledge with us. We are really grateful to you, sir. Hand folded thanks to you. If anybody has any query, they can ask. Or one information is there that I have shared a feedback form in the chat box. So if anybody wants to get a participation certificate, kindly compulsory fill that feedback form. So that form is available on the chat box. Anyone can fill it once only, and the feedback form would be same for all the session. After this session, we will meet again at 12:15 on the next session on the sports physical therapy. So for that, I have sent the registration joining link on your registered mail ID. If anybody has still not received the mail, they can personally WhatsApp me on my number. I am providing my number on the chat box, sir. They can anyone can WhatsApp, and I'll provide the registration joining link to you all. And do not forget to fill the registration form. Handfolded thanks and sincere gratitude to you, Annamalai sir. And we are really honored to have you with us on the board.
So thank you, Himanshu, and thank you, Harsh. Really, it is an amazing experience for me. And once again, I wish you all the great, happy World Physiotherapy Day on September 8th. And really thankful to you all. Thank you so much.
Thank you, sir. Thanks a lot. Happy World Physiotherapy Day to all. Thank you.
Thank you.